I was walking through the removable department the other day and I saw an interesting case, and I think it's something that a lot of dentists aren't necessarily aware of, something that we can do here at the lab that might help you out. Really nothing particularly exciting about this bite block. It just happens to be a patient where I looked down at the lab slip and I noticed that this patient has a history of fracturing full upper dentures. In fact, according to what it said on the lab sheet, the patient, this particular male patient, has broken 4 full upper dentures before. And obviously that's going to probably be cause for concern in your mind about what am I going to do differently to this new denture so this patient will not break it. And in a lot of cases, a doctor will request a cast mesh to be buried, into the interior, the palatal part of the denture when we process it. And rightly so, doctors believe that it's going to support and kind of strengthen the denture and help resist fracture, but really what we tend to see it doing more than anything else is the mesh kind of holds the broken pieces together once it actually cracks, because in acrylic, the greater the mass, the greater the strength. And just to put some mesh in there, the acrylic is still going to crack if we make it thin, and the mesh will hold it together, but that's not really great because we have to reduce the acrylic mass a little bit to get the mesh in there anyway. So what we suggest now, and this is something that you can do, boy, that's really on there. It's something you can do next time you want to have a full upper denture you can be assured is not going to crack, is that we'll actually cast a palate, as you can see here, for a full upper denture. And it's thin, and it's actually very light, and it's extremely strong. Unlike mesh, when you hold the mesh, you can actually bend it back and forth before it gets embedded into the acrylic, but not so with this. This is just absolute. You know what this is like. This is like a cast framework on a partial or anything like that. It is super strong and rigid. So, this gets fabricated so that you can still have the ridge and the post-dam in acrylic, so we still get a nice fit all the way around the periphery, including back on the soft palate as well. And there's going to be acrylic on the inside of the entire thing, so it'll be easy to adjust and it'll be relineable as well. But this can actually sit inside of the acrylic and reinforce it without having to thin the acrylic as much, and as opposed to the mesh, which is just going to provide support once it cracks and hold the pieces together. This can actually provide some serious support. And so next time you've got a patient who has fractured even one full upper denture before, you want to think about doing something like this, a cast palate. Even if you haven't heard of it, we'll probably call you and suggest it to you, but if you have heard of it, or if you're using another laboratory, request a cast palate like this. It's going to do a much better job of reinforcing that full upper denture for that patient who's got a really strong bite and threatens to break it. And another application of that is in a case like this, a case that I saw next to it. All these cast palates were right next to each other, and this is a patient where it's almost a full upper denture, and we've all had patients like this before where they don't want to get rid of these last 3 teeth, and you and I both know they'd be better off getting rid of these last full 3 teeth and having a full upper denture in terms of fit and function. But this is a neat kind of transitional appliance for a patient where if they're willing to put up with a couple of clasps on those anterior teeth, and they typically are in order to be able to preserve those teeth, we can do that same cast palate in here at this time and strengthen this. And again, this will be acrylic all along the periphery and on the posterior aspects of it and underneath on the tissue side as well. But you can probably see how in this case for this patient, when they do end up losing these 3 teeth, which it stands to reason will happen at some point in the future, it's very easy for us as a laboratory just to add these 3 teeth on and have this same appliance keep functioning and have the same fit and have the same function as it did before as soon as those patient loses those last 3 remaining teeth. So again, using what is a partial at this point to design it with the full palate with the mesh on the inside and the acrylic post-dam, it's going to be very easy to convert this case to a full denture when the patient loses these 3 remaining teeth.